All right. So, for those of you who do not know about Support for Families, we are an agency that's been around for many, many years in San Francisco. We are dedicated to supporting the families of children and youth with disabilities and complex healthcare needs in San Francisco County. Our mission is to ensure that families of children with disabilities, learning needs, complex medical needs, and the providers who support them. So some of you this evening may be professionals, and we're always glad to have you with us as well. Um, have the knowledge and support so that you can make the decisions that enhance the well-being of your child and help them flourish. So we're going to launch into a lot of information tonight. No matter where we are in the slide deck, we will stop at 7 to take your questions. If you have a burning question as we're going through that you're really confused and it can't wait, please put it in the chat or raise your hand or unmute and just say, can I ask a question? If it's a bad time, we'll just say, give us a minute, and so on. We know that the systems we're talking about tonight we're going to be talking about regional center mostly, are very overwhelming and complicated. And so we do all kinds of things at Support for Families to help you along the way in your journey. We offer workshops like this, trainings, resources to help you know what your rights are, how to use your rights effectively, whether it's with the school district through special education or other kinds of agency support, early intervention. We also provide a lot of opportunities for community engagement. One of the things we really are proud of, and we encourage you to have your young person, if you have a youth, think about joining, is our Youth Advisory Council, which meets once a month to do leadership and also support and have fun. And that's usually in person, sometimes remote. So we're trying to meet everybody where they are and provide as much support as we can. We do our work and we never charge families for our work because we receive federal, state, county, and city grants and private donations. If you ever feel so inclined, we always welcome donations so we can keep doing the work. And we really appreciate our funders, and a lot of the things that we cover are things that we promise them we will cover as part of our grant. So what we're going to do tonight is talk about regional centers. And I just want to preface this by saying, I remember many years ago when someone said, have you thought about applying for regional center services? And I had no idea what they were talking about. I was still trying to learn the special education system with the school district with my child who's on the spectrum. This was all new to me. So we're going to talk about what a regional center is, who it serves. We're going to discuss the importance of person-centered planning, which is, it's very much similar if you have a child who has special education support and an IEP, where we talk about an individualized education program. Regional center really focuses on providing planning that includes the client, which is the term they use, the person who's eligible for their services, in the center of everything that they're doing. We're going to talk about regional center eligibility. It's a little confusing. And then we're going to spend some time, so just going to take us through how regional center and our school district services interact. Most of that's going to concern children who are in public schools, but we're happy to take questions if you do have a child in private school. Then we're going to talk about what changes at 18. And really the most important thing, which is, know where to go if you need help. So that's the agenda, and we're going to launch right into it. So I mentioned person-centered planning. What the heck is that? It is an individualized process that says that the person with a developmental disability is at the center of the planning. They have the most influence. It should be about them. One of the best advocacy tips I can give anyone is to talk about, gee, it sounds like you're describing a lot of challenges for you as the case manager, as the program, as the school, whatever it is. But can we please put this young person back in the center of the discussion, because this is really supposed to be focused on what they need. We try to focus in person-centered planning on identifying a person's strengths, preferences, and goals. There's an emphasis on self-determination, meaning you making decisions for yourself. And one of my favorite saying is that, you know, independent living doesn't mean that you're doing everything by yourself, but it says that you're in charge of what people do for you and how it's done. There's an emphasis on self-determination collaboration, and collaboration means working within these systems, often very complicated systems, it feels like, to try to get everybody working together on the same team. Something that a lot of parents tell us is that they often feel like they're the ones who end up directing traffic, trying to get the school district to talk to regional center, to talk to other agencies like Department of Rehabilitation or the healthcare system. And I just want to acknowledge that that is one of the most frustrating things as a parent, and certainly as our young people take over their own decision making. I think one of the most challenging things for them is that it's really hard when there's no one else but you who's trying to get everybody else to work together, and it is a big challenge. Person-centered planning encourages the child or the youth or the adult to participate in the decision making. Doesn't mean they have to make every decision by themselves. They may or may not maintain all their own independent decision making. They may have some help with that. We'll talk about that. They may have even a conservatorship. Nevertheless, no matter whether any of that is true, person-centered planning means that we're still taking the perspective of the client themselves in terms of what they need. So we're not doing this training on this topic tonight, but we do want to make sure that we talk a little bit about it, and we'll come back to this when we talk about what happens at 18. But part of person-centered planning is thinking about how your young person will make their decisions, excuse me, when they turn 18. Here in California, when you turn 18, you are considered to be a legal adult unless someone takes action to conserve you. Sometimes you hear the term guardianship used. In other states, they use the term guardianship. California uses the word conservatorship. But we always want to be thinking from the time our children are very young, how we're going to help them be in a position to make their own decisions to the greatest extent that's appropriate for them. So supported decision-making is a way to allow a young person to, at 18, to make their own decisions, but to not do it alone, to create a team of supporters and trusted professionals and friends, and certainly family members, that a team they put together with help so that they can advocate for themselves, but have other people to help them with that. And again, we do trainings on that topic, and we're going to come back to this, but we just wanted to start off by making it really clear. Okay, so let's start with what the heck is a regional center. If you've come from another state, just know that these services are available through the Department of Developmental Services in other states, but California is the only state that has regional centers. And that actually came about because of legal action centered on making sure people were not institutionalized or placed in settings that were very, very restrictive, and making sure that their rights to be in charge of their lives and their own decision-making were preserved. And so part of that solution was to create this regional center system. These regional centers, and there are many of them in California, serve people with developmental disabilities. They operate under a contract with this California Department of Developmental Services. So really the agency that's really in charge is the Department of Developmental Services. Regional centers are nonprofits that report to DDS. That's the acronym for the Department of Developmental Services. And they provide lifelong individualized supports so that people with developmental disabilities are not in overly restrictive settings, stay in their community, stay to the greatest extent possible in charge of all their own decision-making. And again, it is California specific, but other states do have similar laws. It's just that in California, we've really made it, we put it in law and we put it in practice in the form of regional centers. So here's a map of the regional centers in California. The one that serves San Francisco also serves San Mateo and Marin counties. It's called Golden Gate Regional Center. Some of you may be very familiar with them already, and some of you may be new to this, but they serve those 3 counties. And that's Golden Gate Regional Center. We're going to call them GGRC tonight because everybody loves acronyms. So the role of the regional center, in this case GGRC, is that they determine whether someone's eligible for their services. They develop an individualized, I'm having a moment.
Program plan.
Thank you. I was going to say person-centered because I'm still stuck on person-centered.
Okay.
Individualized program plan. So again, notice this isn't an IEP. The E in IEP stands for education. And IPP is what they get through Regional Center. It coordinates and funds disability services. It connects families to community resources. And it is a separate system from the school district, a separate system from medical care, a separate system from IHSS and in-home support services and Social Security and all kinds of other things. It is its own system. And this is very confusing for many, many of the families that come to us at Support for Families for Help, because it's really hard to know who's in charge of what. So we're hoping we can allow you to have some clarity about that this evening. Who is eligible for regional center services? So first of all, I want to mention, we didn't include a slide about this because this presentation is not about early intervention. And we will do a presentation on early intervention, which is 0 to 3, up until 3, and regional center in the future. But 0 to 3 early intervention services are actually provided under the same law that creates special education, IDEA. It's a different part of the law, and it doesn't require that a child or a baby or infant or toddler meet eligibility requirements under the Lanterman Act, which we're going to talk about in a minute. The Lanterman Act is the law that guides regional center services for people with developmental disabilities. So I'm going to be talking about what happens starting at age 3. Starting at age 3, a person, including a child, can be evaluated by the regional center to see if they're eligible, and they have to meet certain criteria. So the criteria are they have to have a diagnosis of a developmental disability, such as intellectual disability, autism, cerebral palsy, epilepsy, or a closely related condition. It just has to impact them in certain ways. We'll come back to that. The disability has to have begun before age 18, even though if someone wasn't diagnosed until after 18, that does not mean they cannot become a regional center client. It's just often more difficult because you have to create all those records that show that even though there was never any formal diagnosis or regional center eligibility, it still was present, and you can show evidence that this young person has been struggling with similar kinds of challenges for a long, long time. So it has to be not a new thing. So for example, if you have a traumatic brain injury and it happens through a car accident when you're 19, you're not going to be a regional center client because was not present before age 18. On the other hand, if somebody missed the fact that your child had autism for many, many years because they were so good at masking it or hiding it, or you provided so much support, this happens to a lot of us as parents, that we kind of help our children's pass or get through their difficulties by providing a ton of support ourselves. And then they turn 18 and it suddenly becomes very clear that since we're not going to be here forever, and because young people often start to say, no, mom and dad, I don't want you to help anymore, suddenly it becomes very clear that they have a developmental disability that might need regional center services. So the disability needs to be expected to last throughout their life, because once you're a regional center client, you are a regional center client for life. Once you are eligible, it is a lifelong eligibility. And the disability that you have has to be a developmental disability, which means it causes functional limitations What are functional limitations? The simplest way we can explain it is that the person or child needs extra support to do daily activities, self-help, taking care of themselves, functioning independently, doing things that are developmentally appropriate for other children. Think about things like walking to school safely, crossing the street. All of those are functional limitations, or knowing what to do when you're sick, all of those kinds of things. So that's what makes you eligible for regional center services, is that you have a diagnosis, and you don't have to come to regional center with a medical diagnosis. Regional center conducts an evaluation. So it's, if you have that medical diagnosis, though, it can make the process happen more efficiently. That disability has to have started before age 18, even if it didn't get diagnosed until later, and it's expected to be lifelong, and it causes functional limitations. So those are the big indicators. How do regional centers determine eligibility? They do it not unlike how school districts determine special education eligibility. They're supposed to look at a variety of sources of information. They may look at medical records. There may be evidence, for example, for a child who has Down syndrome, that they have been diagnosed with Down syndrome, and or other kinds of genetic conditions and differences that we know often result in developmental disability. There can be information from the school district that they did an evaluation, and even though schools don't medically diagnose anyone, that educational eligibility can be very helpful for a regional center to see that the child has needed supports, and that the school was put them into an eligibility category. Notice I'm not saying a medical diagnosis, that's for healthcare providers, but the school put them into an eligibility category that is typically connected to a developmental disability, such as autism or an intellectual disability, and sometimes other kinds of conditions. There may be psychological records or neuropsych evaluations that have been done. They may rely on that. They also conduct or review assessment and evaluation themselves. They're supposed to be looking at how the child or young person's disability affects their everyday functioning. And so this, everything from there, we have some children where they don't have a lot of spoken communication. They may be having difficulty with things like toileting, with things like self-regulating, knowing how to stay safe, all the way up to someone who may look at first glance like they don't have those challenges, but the evaluation reveals that they do, and that is discovered in part through talking to the family, talking to the teacher, observing the child or young person in terms of how they're functioning. There are really important legal timelines that regional center has to follow when they're evaluating whether or not a person is eligible for regional center services. They're really looking to see, I mentioned this earlier, to see if they're eligible under something called the Lanterman Act, which is the law that says, this is what makes you eligible for regional center services. And we have some resources for you that explain that. We know that for GGRC, they're not the only regional center, but we know for GGRC in particular that there's been a lot of non-compliance with legal timelines. Families are telling us that they're waiting months, even years, to have these evaluations conducted. And this was a problem before the COVID pandemic, but they don't feel like regional centers have ever gotten close to where they were before since, and it's very, very frustrating. And part of the reason it's frustrating is that, just like with an IEP, we know that early intervention and support matters, and the kind of help regional center can provide, the kind of help the school districts can provide, really the sooner the better, and yet we have these delays. So although we can't tell you quickly tonight how to solve that problem, knowing what the timeline is really important, because you can identify the non-compliance. In other words, when you're able to write and say, on XYZ date, I wrote to you and told you that I thought my child might have a developmental disability and I wanted them evaluated to see if they were eligible for services under regional center. And gosh, it's been, 120 days and you were supposed to respond in 50 days and, what's going on. There are ways that you can solve problems, and we'll talk about them when they aren't being compliant with that timeline. So we know that delays are common and that they're a frequent concern for families, but we know that information is power. So if you know what the timelines are, then you'll know they're out of compliance. And then you can call us and say, what are my options in this kind of situation? You'll note the box down at the bottom that talks about how a diagnosis alone is not sufficient to determine eligibility. This is something that when I was providing direct service, I remember many, many families were concerned about. They would say, how in the world can I have a medical diagnosis of autism from UCSF, neuro developmental pediatrician, top of the line international expert, and yet regional center or even the school district are telling me my child's not eligible? And the reason is that a medical diagnosis isn't the only thing we look at. Again, remember I talked about functional limitations. So if you have a child with autism, but they can walk to school safely and they can take care of themselves and they meet some of those basic requirements. Not all people with autism are the same, and people have a different level of need. It is possible to have a medical diagnosis of an intellectual disability or autism or cerebral palsy, epilepsy, and not be eligible for regional center services because that developmental disability is not creating those functional limitations. So that's an important thing to remember. And I think one of the ways that you show functional limitations is by talking to parents, because if anybody knows what a child's functional limitations are, it's the people who are actually doing the day-to-day caretaking and see them across their day and what happens on the weekend and so on. So there are these 3 different systems. There are 3 different decisions. And we wanted to make it really clear because we get so many questions about this at Support for Families. So as I said, gosh, my child is diagnosed medically with a developmental disability. Why do I need to have a school district evaluation? Because now they know my child has autism, they should get services. No, it doesn't work that way. They have a medical diagnosis, so they're eligible for some of the supports through the healthcare system. That doesn't automatically make them eligible for special education. The school, or even a 504 plan, the school has to do their own evaluation to see whether the challenges that child or youth are having are really fit within the criteria of educational need. So they're having trouble learning. And I'm not just talking about academics, right? They're having trouble learning functional life skills. They're having trouble learning academic skills. They're having trouble communicating, whatever it is, but it has to be related to education for the school. So they have to evaluate to look just for that, through that lens of education. A doctor's looking through the lens of a medical diagnosis. And then you have regional centers, just to keep things even more interesting. So does this person, this child, this young person have a set of challenges that meet the legal definition of a developmental disability? And as a result of that, are there substantial functional limitations? So do they meet our definition? And they don't just take what the school district provided, although that can be helpful. They don't just look at what the doctor diagnosed, although that can be helpful. They still have to go through their own process of eligibility. So it's highly inefficient and frustrating for families. We know that because you're looking at 3 different systems here, and these are just the big ones. There's lots of other kinds of help out there where you may need to go through other kinds of eligibility processes. All right. So Sarita, I think you were going to take over at this point.
I can.
Are we not to your place yet?
We can be.
Okay, why don't you go for it?
It's okay.
Water, so you go for it.
Okay. So school placement does not decide eligibility. So once the individual completes their high school diploma or the alternate when they're 22, it does not end the eligibility for services for the individuals. It continues on, right? The regional center will develop the IPP because the IEP is no longer in place once a person leaves high school. And transition programs, they don't, any other services that they had been receiving does not replace, what the regional center can provide after this individual leaves or finishes their high school diploma or, alternates diploma or certificate. Again, the IEP is no longer valid once that person is finished with high school, right? You can share your IEP with the regional centers. It can be helpful in terms of looking at, what accommodations were successful, which were not, what kind of supports were really successful for that student. But once high school is done, certificate, diploma, alternate diploma, IEP is no longer binding. So what happens is the regional center kicks in with the IPP that Cheryl mentioned earlier, the individualized program plan, which looks somewhat like the IEP, but it's a lot more broad. And so it's not just specific to educational needs and educational accommodations. Next slide. It can be confusing, IEP or IPP when one starts and when the other ends.
Yeah, let me just clarify something, just because I know exactly what you mean, but I want to make sure because the language is confusing.
Mm-hmm.
So it's not just that you completed high school, it's that you completed public school. So that might be at 22 if you needed support after 18. So the child didn't finish with a full high school diploma, they were working on an alternative diploma, or they were still receiving services working on what's called a certificate of completion. But the big cutoffs are you either get a regular high school diploma, cha-ching, you're done, or you turn 22, or the other option will be the young person says, I don't want services anymore if they hold their own rights. So, okay, let me go to the next slide for you.
So here are some services, examples of some services that the regional center can provide before they exit from high school. There's behavioral or communication supports and services, various assessments, camping, social skills, summer school training, other family support services, childcare, respite, counseling for clients, as well as transition planning. But it's also important to know that the school remains responsible for these educational services and that the regional center is the payer of last resort. So the regional center may provide non-educational supports because the school's still in charge there with the majority, if not all, of the supports. And the transition planning, the focus on planning for preparation to adulthood, that has to begin in high school. So the schools are definitely still in charge of that. Next slide.
Yeah, and I just want to add too that one of the most common services you see, because a kid, again, can be found eligible for regional center at age 3. Mm-hmm. And a lot of times families are saying, what's the school district's responsibility to me, or to my child rather, because they don't seem like they're doing anything. Well, they still need to provide respite. They can still help with this after school program. Sometimes regional center can provide an aid to participate in some community programs. They just don't want to touch education until the child exits, because as Sarita said and is about to explain, they're the payer of last resort.
So what does this mean? It means that regional center will pay only if no other agency is paying for that service. What are the other agencies? Of course, the schools, private insurance, Medi-Cal. Families sometimes pay out of pocket, but they're not expected to pay out of pocket initially. So you have to go through all the possible sources of payment before the regional center will kick in. The regional center may say they won't pay it, but it's important to get a denial letter, and then you can appeal, of course. If they say, no, we can't pay this or we won't pay this, you can appeal, and there's an entire process to follow in terms of appealing a decision by the regional center.
Yeah, and I just will give you an example. So very often there'll be a question about whether health insurance should pay for a service. And so a family will say, well, I really think it's important for my young person to get support, or my child to get support for like mental health therapy. And they'll say, well, try your Medi-Cal first, try your health insurance first. And if they deny you, then appeal it. And then after you appeal it, then bring us the denial and the appeal. And then if we still think that that child needs that service, now we've become the payer. Again, because they're an eligible regional center client. But it's a lot of hoops that families are expected to jump through before they actually can get regional center to pay, because by statute, by law in California, regional centers must be the payer of last resort, except that they can't say, oh, as a parent, you're so rich, you should pay for it. That's not how it works either. There are occasionally situations where the family might have a share of costs, but it's unusual. In general, though, if there's another system out there that might provide the service, they're going to send you there first, and they're going to say, get a denial, file an appeal, bring me the paperwork, and then we'll talk.
So what changes at age 18? I've always wondered about this cutoff age 18 and how we decided upon 18 being the age where youth becomes a legal adult. So at 18 years of age, that youth can legally make their own decisions, and independence becomes a focus, for families as well as for the regional center and the IPP. Typically, youths will allow their parents and their families to continue to help them to make decisions going forward, but they can also say no, they don't want their families to help them make decisions, because the regional center and in drafting the IPP will focus on that youth's choices, their interests, their choices, what their goals are. Supported decision making, we touched on it earlier, Cheryl talked about it earlier, is very, very important during this transition, because this is a time when, the youth can decide who's going to help me, who's not. Am I going to do this on my own? And then the focus now is no longer education or educational goals. Now the focus at 18 is increased inclusion and community integration. So what does that mean? What does that look like in terms of increased focus on community integration? That means, work. Where are you going to work? Where are you going to live? Right? Do you need supports in your work? Do you need supports to live independently? What do you want to do? Do you want more school? Are there supports at a college, at the university, vocational ed, apprenticeships? So this slide says what ways students leave the school system. Again, they can graduate with a regular high school diploma at 18, or they can continue with SFUSC until they're 22. And receive the services and get an alternate diploma or some kind of certificate of attendance or participation, or they age out of school, school services at 22. So when school services and regional center becomes the primary support, and they will draft that IPP, and hopefully there is a transition plan already in place from the high school that can be helpful once they get into the regional center system. And so case management, again, will be the responsibility of the regional center.
And again, just to clarify, the child may have had an IPP since age 3. Mm-hmm. So they may have an existing one, and maybe they've been meeting every year to update that IPP around those other non-school-based services like respite or recreation or community integration. I've even had situations where a child has such significant behavioral needs and self-regulation needs that they can't live at home anymore. Regional center can sometimes even fund a group home. I mean, there's a lot regional center can do, but they're not responsible for anything related to the educational piece until that child is 18. So when we talk about the IPP after 18, we're talking about that first IPP that's now being done with the young person at the center being the decision maker. And this is why we really encourage you to come and learn more about supported decision making, because I just want to be clear. Some of you tonight may have children or youth for whom the idea that they're making their own decisions is really pretty far away. They may have really significant needs, And you may not even be thinking about anything except, of course, we're going to conserve them. They're going to need that kind of help. They have really, really significant developmental disabilities. They're going to have a hard time ever really being in charge. That doesn't mean we still aren't providing opportunities for them to show us in whatever way they can, what their preferences are, what they want. But for those children and youth, it becomes really clear that they might need a conservatorship. But we also hear from our school, we hear from our families a lot that schools will even say, "Oh, your child's almost 18. When are you going to conserve them?" As if that's a done deal, an automatic thing. And so we just really want to encourage you to understand regional center is not making this distinction. All right. Regional center is saying whether they're conserved or not, if they're eligible for our services, we give them our services. The difference is just if they're conserved, they're going to be working more directly with the family in terms of the decision making and so on. But they're still supposed to be providing person-centered planning, asking the youth first, and so on. So it's not real straightforward, but don't be talked into the assumption that your young person couldn't be independent and make their own decisions. And even if you do decide the best thing for your child is to do a conservatorship so you retain that decision-making ability, that does not mean that you're not continuing to help them learn how to make their choices and their preferences and their wishes known. Go ahead, Sarita.
Here are some examples of services that the regional center can provide. Daily services, day services, like programs where they can improve on or work on their social skills, right? Living skills training. They might provide supports for independent living, maybe some adaptive skills training, adaptive equipment itself, training for public transportation, maybe even health advocacy, how to advocate for themselves in terms of the healthcare, employment, definitely preparation. They can even help with like internships and apprenticeships, locate them. Let's see. Yep, got them all. Okay, so these are two ways, and I think there's a lot of confusion with this. Two ways to receive regional center services. There's a traditional service model, where the regional center does coordinate all the services, and the services are provided through approved vendors. These approved vendors are approved by the regional center. And then there's a service coordinator assigned to the family that plays a central role. But there's another method, another pathway, and Cheryl, I think, mentioned it earlier, the self-determination program. This allows families and the individual with disability to take control of their own services, their ongoing services, and their needs, and even hire, the people they want to hire to manage their agents, manage their own services. So this is more empowering. It has more flexibility and definitely more choice. The person and the family is going to be responsible for the individual budget and not the regional center. They have definitely much more control over the money, how it's spent. But they also have to keep track of it. They also have to keep track of the payments to their chosen vendors, their chosen people, and who they hire. They have power to do that. So as great as it sounds and as great as it is, it does entail a lot more responsibility in terms of managing the supports, the people, and the budget.
Okay.
Cheryl, you can add.
Yes. No, I mean, you covered it. What we will do a future training more on, especially on, and we provide coaching and training on the self-determination program at Support for Families. So if you want to learn more about that, but I will say that a lot of families have said to us, this is exhausting. I shouldn't have to be my child's case manager, right? Whether it's about the school district or whether it's about regional center or medical care or whatever, it's exhausting. But so for those families, the idea of doing the self-determination program isn't real appealing because you're essentially are your child's case manager. You might say, I know my child needs music therapy. Nothing makes my child, and you can do self-determination before 18, by the way. Either of these models works at any age of eligibility. So I'm going to get music therapy and I make sure my child can take guitar and have a one-on-one aide to go with them, and have it even includes, for example, someone to be your advocate. You can use your budget in the self-determination program to have someone who acts as your, I don't know if advocate's the exact perfect word, but your help you navigate the system. So there's help there, but you have to keep the budget. You have to keep incredibly good records. You can be audited. There's just a lot of responsibility. In the traditional service model, regional center says, okay, we're doing the IPP. What kind of support does this child or young person need? And okay, these are the approved vendors we have that can do that. Oh, we don't provide that service, so we have to go through a whole process of approving something like music therapies. It could take a long time. So you have a lot less flexibility, but you're not in charge of any of the sort of business side of the house or a lot of the decisions. So it's one of those things where you could be ready to do the traditional service model and then down the road decide to do self-determination, or try self-determination first and think, wow, this is too much. And so just know that there are options. I see that there's a couple of questions, and let me just address them because they're easy ones. What age is recommended for conservatorship? So you can't conserve a child under 18 because by law, their parent already holds all of that decision-making right. This is where it gets really dicey for some of our kids in foster care and so on, where there isn't necessarily an adult who's that decision maker, and the state is not a particularly good decision maker. But once they're 18, then that if you think that the child may need more help making decisions, you can check, do supported decision making. Hopefully you checked into it long before then, because we want young people and children making their own decisions as early as possible. But no later than 18, if you don't do anything and they turn 18, every system, doctors, lawyers, hospitals, school districts, must assume that they're the decision maker, no matter what their, parents will say, what do you mean? How could the school or how could regional center think my child could possibly make their own decisions, even though they're 19? Look, they have significant developmental disabilities. They don't have spoken language. They have all kinds of complex medical needs, and that's ridiculous. But unless you do something, they hold their own rights at 18. So just be aware of that. So if you're thinking your child might need conservatorship at least 6 months before they're going to turn 18, we suggest that you start checking that out and at least do your research to decide what might make the most sense. And then somebody said, can we have access to the PowerPoint slides? Yes, they will be coming to you in the next 2 days. And oh, thank you. So you already answered. So we will send the slides out and the resources. And the current DDS director, I'd have to look it up for the state of California. I will
Pete
do that.
Cervinka. I think I put it in the chat. Pete Cervinka, as of December 2024.
Okay, perfect. Oh, thank you. I didn't scroll down far enough. But yes, so if you need the contact number, that's one of the reasons why you might call us at Support for Families. I have a concern. I want to file a complaint. I think the regional center isn't doing the right thing, and you guys are sort of responsible for approving them. And so you can reach out to us, and we can help you navigate who to talk to about what. The other thing to know, and this is in a later slide, but I'll just say it now, is every single regional center in California has not just ways to solve problems, but they also have something called a client's rights advocate. And that is someone who actually works for the Disability Rights California organization, not for the regional center, but their whole job is to help families who are trying to navigate problems in regional center services, sometimes even with school-based services, so they can provide help. And they're usually an attorney or very close to an attorney, and they're available for help. So if you're having problems with regional center, you might want to start with a client's rights advocate or start with calling Support for Families, and we can help you understand all of those next steps. Okay. Sarita, go ahead.
Planning tools. Well, I can barely see it.
Okay, I can see it. So
go ahead.
Yeah,
go ahead.
So we just wanted to show you, and again, you're going to get these slides, what an IPP face page look like, right? See, it says Golden Gate Regional Center. It's a person-centered individual program plan, an IPP. So that's what that page looks like. And right next to it is a front page of an IEP, which is an education program. And so that shows you, those are two different documents for two different systems. You could share either one with the other agency. And again, you also might have like a medical diagnosis or medical record information you want to share. But they're different systems with different rules and different ways of navigating them. So we just wanted you to sort of be able to put your eyes on it.
Cheryl, there's a comment that OCRA is paid by DDS and is not allowed to sue the regional center on the client's behalf.
They're not suing, but they're allowed to help you try to resolve, and they will do investigations. So they have power to, and they can also refer you back to Disability Rights California if they do think you're at the point where you need representation. And it's, they pick and choose which cases they think are the most powerful. But the client's rights advocate is there to help the client and their family, whoever's supporting them, know their rights, know how to navigate through problems. And they do investigations when they think regional center is out of compliance. It's not a state hearing. They're not representing them in a hearing process, but they certainly can help them prepare and understand all their options. Go ahead, Sarita. You want to talk about the advocacy tips?
Sure. These are very important because I find myself, I say this to the parents that I support repeatedly. What matters is everything on paper. Get your forms, your evaluations, all your IPs, all the records organized into a single binder, and keep track of it because you're going to need it. And it actually like delays the process sometimes, depending on where you're working with, because families have to get all the paperwork together and organized before they can actually proceed through the process. So definitely, prepare all your documentation, all your IPs, all your medical records ahead of time. The paper trail rule, save everything, emails, everything has to be in writing. I think I said that 50 times this week. Get everything in writing. Paper trail, keep it all documented and organized. And here's another thing that's very important that I think a lot of families, are learning along with us because it changes, is know their rights. Know your rights. You have a right, for example, for an interpreter in your native language, and it shouldn't cost you anything at no cost. You can definitely bring a friend or a family member. And I have served, I'm sure Cheryl also has served in that position before, as a friend and a family member to a meeting, for support. It doesn't have to be legal or a formal advocacy, just for support, either to help clarify some information, help clarify vocabulary, and just for general emotional, socio-emotional support. Be clear and specific. Yes. Explain how a service will help your child reach a specific milestone or increase independence. Be very clear in terms of, I need this for this outcome. I need this support to achieve this goal. So the more specific and the less broad, the better. Ask for the notice of action. If a service is denied, ask for formal notice of action. During school, it's like the PWN. Some of you probably have heard of that before, but notice of action. So you can begin the appeal process. You need, again, in writing. Cheryl, examples.
Yeah. And so I think a couple of things. The paper trail rule, I would give you the example of, you call and talk to let's say the youth calls and talks to their regional center case manager, and you're sitting there with them and they say, I think I want to learn how to take the bus by myself, and I want some help with that. And somebody says, oh, well, we can't do that. We don't have anybody to do that right now. That would be a situation where you might follow up in writing. Thank you so much for talking to Joey today. As you know, I was also present, and I'm writing together with Joey because he's over 18. And we would like to have you put it in writing why you can't do that. Rather than just kind of accepting that they said that it's not our policy. Ask for the policy. And the notice of action, I think some of you have come to IEP clinics at Support for Families, and one of the things that I always say when I'm doing them is, it is often better to get a no in writing than to have nothing, to be stalled out. Oh, we can come back to that. We can think about that. I'm not sure if we can do that. The other thing I want to make sure you all know is that If you happen to have a child who has special education services or an IEP, you will probably know that at every IEP meeting, there needs to be someone who's like the administrator, the decision maker. And there's rules about that. That person actually has to be able to make a decision and commit a resource from the district. Like, we will provide busing. Will move the child to this non-public school. Somebody who, can agree if the team thinks that this is necessary and can commit those resources. Regional center has the same requirement. There needs to be someone in an IPP meeting who can say, yes, we will provide music therapy. You've made a good case. I've looked at the documentation and everybody's sort of on the same page, and that makes sense. It's one of the big problems. Families tell us all the time that they're case managers at regional center. And I'll say, in all fairness, many of the regional center case managers are very new and have very little experience. They're learning as they go. And they'll say, oh, I need to check with my supervisor. I'll get back to you. And so this is where this action step of, well, it sounds like you're going to get back to me, but my understanding is that you're supposed to be able to make the decision in the meeting, that you're, as the case manager, that's your job. And so when can I expect a notice of action saying that you can't help me yet, but and what will be the time frame within which you'll help me? So push them, even if it's a no. It's better to have a no in writing than just to be sort of out there hanging, wondering what next steps will be and who's in charge of what, and trusting that these things are going to happen. Staff change, rules change. Always better to get it in writing.
And I also want to add, like, I'm working with a family right now, and I said, get a transcript, record the meeting, right? And so I was able to review the transcript to see exactly in writing what was discussed. And you can do that too, and you should do that too for any meeting that's on the phone or in person. Ask for a transcript, ask for a recording.
Yeah. So we're doing really well because we said we were going to stop at 7 to take questions. So let's just quickly go through where to get help. And I want to say, just like with special education, there are resources that explain what your rights are, what the timelines are, what the regulations are. Really good to just have in your back pocket the phrase always, when can I expect that in writing? Can you give me a reasonable date? And also, can you tell me, where is that policy that says you don't do X, Y, and Z? Can I see the written policy? When can I expect it? If you need a document, your IPP or any of the evaluations translated so you can understand them, even if you speak English, we know that that's not always the same as understanding this complex information. And the other thing is, if you yourself need accommodations, if you're the parent, in order to participate, if your child's under 18 or you're helping them participate and they're conserved, and therefore you've retained decision-making rights, you can ask for accommodations because they are a public entity. So, I need large print in order to understand things. I need you to slow down and speak more clearly. I need things to be put, especially for the clients themselves, in plain language that's easily accessible, that's written at a reading level that makes sense for where the client is. And Disability Rights California has many resources about regional center services, including, I think, in like 13 or 14 different languages, information about what is the Lanterman Act that guides, the rules for regional centers and for people with developmental disabilities. They also have, they use plain language in all their documents. So it's very, very helpful to look at their stuff. The Office of Clients' Rights Advocate, I talked about that a minute ago. Again, these are people who work for Disability Rights California. And one thing that might be helpful, since we have a couple minutes, is for you to know that every single state in our country and territory has to have what's called a protection and advocacy organization. They call it a P&A sometimes, sort of protection and advocacy. They have to be some nonprofit organization who's in charge of keeping their eye on what happens to people with disabilities, making sure their rights are preserved, making sure they're not institutionalized, because of the history in this country of exactly that happening. Disability Rights California is California's protection and advocacy organization. They actually can walk right into a school district unannounced and see student records if they think there's a safety violation. They have a lot of power to access, look at a group home, look at programs and so on. And that's why they're filling this role of Office of Clients' Rights Advocate, because they are part of the protection and advocacy protection system to make sure that people with developmental disabilities aren't exploited, mistreated, segregated unnecessarily, and so on. There's also an ombuds person, who's someone who works for the State Department of Developmental Service. That ombuds person can help if it's a situation where maybe regional center is saying, not so much a disagreement or something, but you think something should be covered and it isn't. Maybe they're telling you, we think your health insurance should pay for this and they won't. So the ombuds person can help you resolve problems like that. And then another incredible resource are our independent living centers. The Berkeley had the first independent living center in the country, and now we have them all over the place, and they are great resources. They're usually part of the California Department of Rehabilitation. They work under that umbrella, and they are really good at providing services across the lifespan: support groups, navigation, knowing your resources. How do you find housing? How do you find a healthcare person to provide, like, our community aid, things like that. So they are a wonderful, wonderful resource to find out what's available out there in the community.
Cheryl, I put Pete Cervinka's email up in the chat. And so it's available for you guys there, pete.cervinka@dds.california.ca.gov. And there's a question from Savina. What is the name of the bill that was passed about 3 or 4 years ago that requires regional center to give your child's IPP document during the IPP meeting and not 6 months later?
I don't know it off the top of my head. It's something we've been fighting for with school districts as well, to have like some sort of firm deadline by which they give you this written material. I will look it up and we will add it to the slides before we send them. So I'll have that available by tomorrow morning. I think in general, one of my best pieces of advocacy advice, going back to what Sarita was covering before about putting everything in writing, is doing an after meeting brief. So thank you for meeting with us today. I'm so glad that we had this opportunity. It's always a good idea, you guys, to talk about what went well. I really appreciated the way you really listened to my child and our family concerns. And, I think we have some great things in place, but here's the stuff that's still unresolved. You said you would get back to me about this. You said you would translate the IPP for me within the required timeframes. You said that you don't do X, Y, and Z, and I asked you to provide the written policy. So I look forward to your response, because that's how you create accountability in these systems and I know it's a lot of work. I don't want to downplay how exhausting it is to be doing this, but this is how you create accountability within these big systems. These resources are all great. The Rights Under the Lanterman Act is put out by Disability Rights California. It's a little bit more of a formal document. The next one, A Consumer's Guide to the Lanterman Act, is written for the consumer, the person with the developmental disability. It's pretty plain language, and it has a lot of examples of how they can help, and it's really written for the client themselves. A Guide to California's Regional Center Services System, that we also included from one of our favorite websites, Undivided, the timelines for regional centers. You can see when they're supposed to do what and by when. And then the Office of Clients' Rights Advocate has regional center services information. And then we have information about regional centers in California. Because if you move, this is a frequent question we get. If you move within California and you are now in a county that's served by a different regional center, it's just like with an IEP for special education. There's a whole process for making sure that the services transfer over to the new regional center, and the client or consumer continues to receive services, but it often goes haywire because they get behind and they don't do the required paperwork in time or have an IPP meeting in time. And so you can look at some of those rules and some of these resources. So let's stop there and see if there are more questions. You're more than welcome to raise your hand or just unmute and ask your question, or if you have a comment, we'd love to hear from you. Let's do it. Here's ways to get help from us, just so you have it right in front of you. And while we're talking, please, oh please, take a minute and complete our evaluation form, especially for this training. This is the first time we've done this one. We know that other organizations do overviews, but we really wanted to do something that really started at the beginning of the process. So we'd love your feedback, and we're also required by our funders to gather this information. So please use your phone to scan the QR code. If you can't access it, you'll get the PDF and then you can do it. If you're on your phone tonight to participate, it gets tricky getting the QR code and getting to the website. But please try to fill out that evaluation.